that's really important to understand, because as we talk about, how medicine positions that it is the male body as the standard, well, actually, we were the standard and you are the deviation from that standard.
Yeah, I remember learning in embryo that I believe it was the labia majora, with that testosterone wash, like you just get this sort of stitching up and then that becomes like they come together and then there's like this little, kind of seam and that becomes the testes, right? And I always remember going, wow, that's so freaking awesome.
It is so fascinating, right? Yeah. So, but like back to your point, I think it is important that we recognize that provider bias exists. And if your doctor isn't getting more experience outside of, just depending on where they live, then they may have a bias. So we understand this. For example, I talk about yeast infections in the book. There's that entire chapter about discharge and, what could your discharge be and what can you do about it? Because I swear, like if you're going to get a yeast infection or BV or anything, it's like going to happen on a Saturday night when you cannot get a hold of a provider. So I have all that information in there for you. And I talk about how we say classically the yeast infection is going to be that beefy red tissue. Unless you don't have white skin, then it might look different. It could be a purple hue, or you might not even notice a difference. And I think that's important that as providers, we're educating in that way so that all bodies can understand how to actually identify what's been going on with them and so that they can advocate and get the best treatment.
Yeah. And I would say what you just said is so true. Murphy's Law dictates that you are going to get bacterial vaginosis on a Friday at 5:30 p.m.
5:30.
Everyone's gone home and you're like, damn it.
It'll be like 4:59. And you're like, no, I can't dial fast enough.
That's so true. All right. So let's come back to surgeries for a minute, because you mentioned, surgery is trying to sort of, or surgeons, or maybe a certain segment of the medical establishment is trying to sort of push, the labia should be even from side to side and it should have this pink hue, et cetera, et cetera. What are some of the surgeries, let's say? So I know that we have labial hypertrophy, which for some women, you're on the bike, just everyday sort of activity. I've spoken to Sean Tassone about this a little bit, where there's women that come in and they complain that the labia are too large in so far as they are getting in the way of activities of daily living, like bike riding is a really
or walking.
Or walking.
Walking, especially when your thighs are trying to trap them. And what we're talking about here is the labia minora, so everyone knows. And labial hypertrophy, it's actually a clinical diagnosis, which is a bit of the problem. Is that, again, there can be provider bias. Like, do they want to push a surgery? Or they could just not have had a lot of experience. There's no real standard. There have been some guidelines set saying like, okay, well, maybe if it extends beyond this point, but still it's at the provider's discretion. Yeah. And it is something that I recommend that if one provider tells you have labial hypertrophy and they recommend a surgery and you're not having any symptoms, go get a second opinion, because those opinions can vary widely. So with that in mind, this is why it's important that we don't shame people about decisions that they make. I bring up the topic of labiaplasty in the book because it is problematic when it is a predatory behavior by providers who are doing this service. It's cosmetic physicians, you'll see, have been criticized a lot by the American Medical Association, by the College of Obstetrics and Gynecology, because they've taken to TikTok. And some of the videos have been targeting teen girls. And the most popular surgery is called the Barbie. I don't know if you've taken off Barbie's pants.
She's got nothing. She's got nothing.
Yeah. And that's the standard. That is what is being told to young women whose bodies aren't even done developing, which is, we shouldn't do surgeries on bodies that are, they're not going to do breast augmentation if your body isn't done developing. And yet this, for a while, was one of the top, the top recipients of the surgery was teenage girls. So wow. There can be a time and a place for this. It's much more rare than the occurrence of the surgery itself. So the actual need for the surgery is much smaller compared to the number of people actually getting this surgery. And there is something to be said about feeling comfortable in your body. So although I sit here and I say, like, if it's functional, let it be, I would say let it be, because the labia minora extends up to the clitoral hood, and we don't even understand the clitoris and the anatomy well enough to understand how this might impact your pleasure. And I have had patients that are like, no, it's actually pleasurable when I'm having penetrative sex and my labia minora are being tugged on. Like, that actually feels good. So again, this is where it's highly individualized. And yet, if you are someone who's really struggling with body image issues and feeling like, I can't be comfortable with my body, it's not a situation where we just say, well, the surgery is not